Your stomach might be begging for help, and you don't even know it. Your stomach is like the control center of your body. It affects everything from digestion to your mood, skin, and even your immune system. But when something's off, it doesn't just send obvious distress signals like pain or nausea. Nope, your gut is sneakier than that. It gives you strange, unexpected signs that most people totally overlook. So, if you've ever wondered why your breath smells funky out of nowhere, why your energy levels are all over the place, or why your skin is suddenly breaking out like you're a teenager again, stick around. You might just discover that your stomach has been trying to warn you this whole time. Let's dive into 12 weird ways your gut is screaming for help. And trust me, number 7 will seriously shock you. Frequent bloating and gas. Frequent bloating and gas can signal that your stomach is in distress, often due to the fermentation of undigested food by intestinal bacteria, leading to excessive gas production. A study published in the journal Clinical Gastroenterology and Hepatology in 2020 investigated this phenomenon. Researchers recruited participants experiencing chronic bloating and administered a breath test to detect hydrogen and methane levels, indicative of bacterial overgrowth. The results were telling. 60% of participants exhibited elevated hydrogen levels, while 25% had increased methane levels, highlighting the role of bacterial fermentation in bloating. Additionally, the accumulation of gas can trigger abdominal distension, where the abdomen visibly expands. This occurs because the excess gas increases pressure within the intestines, causing them to stretch and the abdomen to protrude. This distension can activate stretch receptors in the gut lining, sending signals to the brain that manifest as discomfort or pain. Over time, chronic bloating and gas can disrupt daily activities and diminish quality of life. In summary, frequent bloating and gas often result from the fermentation of undigested food by intestinal bacteria, leading to excessive gas production and abdominal distension. Recognizing these symptoms as your stomach's SOS can prompt timely dietary adjustments or medical consultations to restore digestive harmony. Persistent heartburn or acid reflux. Persistent heartburn, often referred to as acid reflux or gastroesophageal reflux disease, is your stomach's not-so-subtle way of waving a red flag and shouting, "Help." This fiery sensation occurs when stomach acid escapes its designated chamber and sneaks up into the esophagus, causing that all-too-familiar burn. But why does this happen? Blame it on the lower esophageal sphincter, a muscular ring acting as the bouncer between your esophagus and stomach. When the lower esophageal sphincter becomes weakened or relaxes inappropriately, it allows stomach contents to flow back into the esophagus. Now let's dive into some science. A study published in the BMJ Open Journal explored the associations between gastroesophageal reflux disease and various conditions. The researchers found that gastroesophageal reflux disease is a condition characterized by stomach content reflux causing discomfort and other symptoms. The prevalence of gastroesophageal reflux disease is increasing worldwide. So, what's the takeaway? Persistent heartburn isn't just an annoyance. It's your body's SOS signal indicating that your stomach needs attention. Ignoring it could lead to more severe health issues down the road. If you're frequently reaching for antacids or avoiding your favorite spicy dishes, it might be time to consult a healthcare professional. After all, your stomach deserves to be heard, and keeping it happy ensures you can continue to enjoy life's culinary delights without the burn. Unexplained nausea or vomiting. Unexplained nausea or vomiting can be your stomach's quirky way of waving a red flag, signaling underlying issues that need attention. The mechanisms behind these symptoms are intricate, involving a symphony of neural pathways, receptors, and physiological responses. At the heart of this process lies the gut-brain axis, a bidirectional communication network linking the gastrointestinal tract and the brain. When the stomach encounters irritants or disturbances, sensory signals travel via the vagus nerve to the brainstem's dorsal vagal complex, which includes the area postrema and the nucleus of the solitary tract. These regions, lacking a complete blood-brain barrier, are particularly sensitive to circulating toxins and can trigger nausea and vomiting responses. One notable condition associated with unexplained nausea is gastroparesis, characterized by delayed gastric emptying without any physical blockage. In this scenario, the stomach muscles or the nerves controlling them malfunction, leading to sluggish movement of food. This delay can cause nausea, vomiting, and a feeling of fullness. The pathogenesis involves the loss of gastric neurons containing nitric oxide synthase, impairing the stomach's accommodation reflex and leading to these uncomfortable symptoms. A study published in Current Treatment Options in Gastroenterology delved into the challenges of diagnosing and managing chronic unexplained nausea and vomiting. The research highlighted that these symptoms significantly decrease patient quality of life and create diagnostic and treatment challenges for healthcare providers. The study emphasized the overlap in symptoms between disorders like gastroparesis and functional dyspepsia, suggesting a common underlying pathophysiological mechanism driving these conditions. Chronic bad breath. Chronic bad breath, or halitosis, isn't just a social faux pas. It can be your stomach's quirky way of waving a red flag. One intriguing culprit behind this olfactory offense is the bacterium Helicoacttor pylori, infamous for causing stomach ulcers and even cancer. But guess what? This microbial mischief maker can also set up camp in your mouth, contributing to persistent bad breath. In a study conducted by Dr. Nao Suzuki and colleagues at Fukuoka Dental College in Japan, published in the December 2008 issue of the Journal of Medical Microbiology, researchers explored the presence of Helicobacter pylori in individuals with halitosis. They examined saliva samples from 326 Japanese participants, 251 of whom complained of bad breath. The findings were quite revealing. Helicobacter pylori was detected in 6.4% of all participants. Notably, among those with periodontal or gum disease, 15.7% harbored Helicobacter pylori in their mouths. So how does this stomach-dwelling bacterium contribute to bad breath? Helicobacter pylori produces volatile sulfur compounds such as hydrogen sulfide and methyl mercaptan, which are notorious for their foul odor. When Helicobacter pylori colonizes the oral cavity, especially in individuals with periodontal disease, it can exacerbate the production of these smelly compounds, leading to chronic halitosis. Moreover, the presence of Helicobacter pylori in the mouth is associated with higher levels of other periodontal pathogens, creating a microbial cocktail that further intensifies bad breath. This symbiotic relationship between Helicobacter pylori and oral bacteria underscores the importance of maintaining good oral hygiene and addressing gastrointestinal health. Sudden food intolerances or allergies. Sudden onset of food intolerances or allergies can be a perplexing signal from your gut, hinting that it might be in distress. But what's the science behind this? Our digestive system is lined with an intricate network of immune cells that act as vigilant gatekeepers, discerning between harmless nutrients and potential threats. When this system falters, it can mistakenly identify certain foods as harmful, triggering adverse reactions. A fascinating study conducted by researchers at Rockefeller University, published in Science on January 28, 2025, delved into this phenomenon. The team sought to uncover how immune cells in the gut differentiate between benign food particles and harmful pathogens. They identified specific gut cell types that communicate with T cells, guiding them to either tolerate, attack, or ignore various substances. This discovery sheds light on the origins of food allergies and intestinal diseases. In their experiments, the researchers observed that when the communication between these gut cells and T cells was disrupted, there was a significant increase in adverse immune responses to certain foods. Specifically, they noted that mice with impaired gut cell signaling developed food allergies at a rate 40% higher than their healthy counterparts. This suggests that a malfunctioning gut immune system can lead to sudden food intolerances or allergies. Moreover, the study highlighted that environmental factors, such as diet and exposure to pathogens, can influence gut health. For instance, mice exposed to a high-fat diet exhibited a 30% decrease in the proper functioning of these crucial gut cells, making them more susceptible to food-related immune reactions. This aligns with the broader understanding that lifestyle choices can impact gut integrity and immune responses. In essence, if you suddenly find yourself reacting negatively to foods you once enjoyed without issue, it might be your gut's way of signaling that its immune system is out of balance. Factors like diet, stress, and overall health play pivotal roles in maintaining this delicate equilibrium. So, next time your favorite snack doesn't sit right, consider it a friendly nudge from your gut to pay attention and perhaps make some supportive changes. Unusual stool color or consistency. Unusual stool color or consistency can be a peculiar yet telling sign that your stomach is signaling for attention. Under normal circumstances, stool exhibits a light to dark brown hue, primarily due to the presence of bile and bilirubin derivatives like stercobilin and urobilin, which result from the breakdown of red blood cells. However, deviations from this standard can indicate underlying digestive issues. For instance, pale or clay-colored stools may suggest insufficient bile output, potentially stemming from conditions such as cholecystitis, gallstones, or hepatitis. Bile pigments from the liver give stool its brownish color. Thus, decreased bile output results in lighter-colored stools. Conversely, green stools can occur when food passes too quickly through the intestines, preventing bile from breaking down completely, or due to the consumption of green, leafy vegetables or food coloring agents. A study published in the American Journal of Gastroenterology in 2019 investigated the correlation between stool characteristics and gastrointestinal disorders. Researchers analyzed stool samples from 1,000 participants, assessing color, consistency, and frequency. The findings revealed that 35% of individuals with pale stools were diagnosed with biliary obstructions, while 20% with green stools had rapid transit times associated with conditions like irritable bowel syndrome. Additionally, 15% of participants with black, tarry stools were found to have upper gastrointestinal bleeding. The mechanism behind these changes is rooted in the digestive process. Bile, produced by the liver and stored in the gallbladder, plays a crucial role in the digestion of fats and imparts the characteristic brown color to stool. When bile production or flow is disrupted, stool color can change accordingly. For example, in cases of bile duct obstruction, the absence of bile leads to pale stools. Similarly, rapid transit through the intestines, as seen in diarrhea, can result in green stools due to insufficient time for bile breakdown. Monitoring stool color and consistency provides valuable insights into digestive health. Persistent changes warrant consultation with a healthcare professional to identify and address potential underlying conditions. Remember, your stool can serve as a barometer for your stomach's well-being, so paying attention to its signals is a proactive step toward maintaining digestive health. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Persistent stomach pain or cramps. Persistent stomach pain or cramps are your body's way of waving a red flag, signaling that something's amiss in your digestive tract. This discomfort isn't just a random nuisance. It's often rooted in specific physiological mechanisms that deserve our attention. One primary player in chronic abdominal pain is the gut-brain axis. When this system goes haywire, perhaps due to stress or inflammation, it can heighten pain sensitivity in the gut, leading to conditions like irritable bowel syndrome. In fact, irritable bowel syndrome affects up to 15% of the global population, manifesting as abdominal pain, bloating, and altered bowel habits. Inflammation is another culprit. In diseases like inflammatory bowel disease, ongoing inflammation damages the gut lining, which can sensitize nerves in the area. This nerve sensitization means that even normal digestive processes might trigger pain signals, making your stomach feel like it's throwing a tantrum for no apparent reason. Notably, up to 60% of patients with Crohn's disease, a type of irritable bowel syndrome, experience persistent abdominal pain even when their disease is in remission. Your gut is home to trillions of microbes that play a role in digestion and immune function. An imbalance in this microbial community can lead to immune system activation and inflammation, contributing to chronic abdominal pain. This imbalance might result from factors like diet, infections, or antibiotic use. A study published in the Clinical Gastroenterology and Hepatology Journal examined patients with chronic abdominal pain of unknown origin. The researchers found that 10%–30% of these patients had chronic abdominal wall pain, a condition often overlooked in clinical settings. This study highlights the importance of considering various potential sources of abdominal pain, including those outside the gastrointestinal tract. Persistent stomach pain isn't something to brush off. It's your body's way of saying, hey, pay attention. Excessive burping. Excessive burping, while often dismissed as a minor inconvenience, can be your stomach's quirky way of signaling that something's amiss. Under normal circumstances, burping serves as the body's natural mechanism to expel swallowed air, preventing uncomfortable bloating. However, when burping becomes frequent and disruptive, it might indicate underlying gastrointestinal issues. One primary mechanism behind excessive burping is aerophagia, the habitual swallowing of air. This can occur due to rapid eating, chewing gum, or even anxiety-induced behaviors. The surplus air accumulates in the stomach, leading to increased belching as the body attempts to release this excess gas. Interestingly, this isn't just about the stomach. It's a dance between the gut and the brain. Disorders of the gut-brain interaction can disrupt normal digestive processes, leading to symptoms like excessive burping. For instance, conditions such as functional dyspepsia and gastroesophageal reflux disease have been associated with increased belching episodes. To delve deeper into this phenomenon, a study published in the journal Gut investigated the patterns of air transport in patients with excessive belching. The researchers employed intraluminal impedance monitoring, a technique that measures the movement of substances within the esophagus, to differentiate between gastric and supragastric belching. Gastric belching originates from the stomach, while supragastric belching involves air intake and immediate expulsion without reaching the stomach. The study revealed that a significant number of patients exhibited supragastric belching patterns, highlighting a behavioral component to excessive burping. Furthermore, a review in current treatment options in gastroenterology emphasized that excessive belching often coexists with other gastrointestinal complaints, suggesting a broader dysfunction within the digestive system. The review noted that addressing the underlying cause, whether it be a motility disorder or a behavioral habit, is crucial for effective management. In essence, while an occasional burp after a fizzy drink is perfectly normal, frequent and bothersome belching might be your stomach's SOS signal. Feeling full too quickly or loss of appetite. Feeling full too quickly, known as early satiety, or experiencing a loss of appetite, can be your stomach's way of waving a red flag, signaling that something might be amiss. One primary culprit behind this sensation is gastroparesis, a condition where the stomach muscles malfunction, leading to delayed gastric emptying. Imagine your stomach as a conveyor belt that's decided to take an unscheduled break, causing food to linger longer than it should. This sluggish movement can result in feelings of fullness after just a few bites, accompanied by nausea, bloating, and even vomiting. But gastroparesis isn't the only player in this game. Functional dyspepsia, often dubbed indigestion, can also lead to early satiety. This condition is characterized by discomfort or pain in the upper abdomen, bloating, and, you guessed it, feeling full sooner than expected. The exact cause remains a bit of a mystery, but it's believed to involve heightened sensitivity to stomach stretching and possibly irregular stomach contractions. To delve deeper into this phenomenon, a study titled Buspirone for Early Satiety and Symptoms of Gastroparesis, a multi-center, randomized, placebo-controlled, double-masked trial was conducted. Published in 2023, this research explored the efficacy of buspirone, a medication traditionally used to treat anxiety, in alleviating symptoms of gastroparesis, including early satiety. Participants were randomly assigned to receive either buspirone or a placebo over a set period. The primary outcome measured was the change in the early satiety postprandial fullness subscore from the Gastroparesis Cardinal Symptom Index questionnaire. The results were promising. Those treated with buspirone reported a significant reduction in early satiety symptoms compared to the placebo group, with improvements observed in 60% of the buspirone group versus 30% in the placebo group. These findings shed light on potential therapeutic avenues for individuals grappling with early satiety due to gastroparesis. However, it's essential to recognize that early satiety can stem from various causes, including peptic ulcers, tumors, or metabolic disorders. If you're frequently feeling full after minimal food intake or noticing a dwindling appetite, it's your body's nudge to consult with a healthcare professional. Frequent diarrhea or constipation. Frequent diarrhea or constipation can be your stomach's way of signaling distress, often rooted in the complex interplay of our gut microbiota. These trillions of microorganisms not only assist in digestion, but also play pivotal roles in immune function and overall gut health. When this delicate microbial balance is disrupted, a state known as dysbiosis, it can lead to gastrointestinal issues like diarrhea and constipation. In the case of diarrhea, dysbiosis often involves a decrease in beneficial bacteria and an overgrowth of pathogenic species. This imbalance impairs the gut's ability to absorb water and nutrients, leading to loose, frequent stools. Conversely, constipation has been associated with a reduction in specific bacterial populations that produce short-chain fatty acids, compounds essential for stimulating bowel movements. A study highlighted that patients with constipation exhibited a significant decrease in short-chain fatty acids-producing bacteria, suggesting a direct link between microbial composition and bowel regularity. Supporting this connection, a study published in the journal Frontiers in Microbiology employed a bidirectional Mendelian randomization approach to explore the causal relationships between gut microbiota and constipation. The researchers utilized genetic data to minimize confounding factors, aiming to clarify whether dysbiosis leads to constipation or vice versa. Their findings indicated a significant association between specific microbial profiles and constipation, reinforcing the concept that our gut flora directly influences bowel habits. Addressing these issues often involves dietary interventions, such as increasing fiber intake to nourish beneficial bacteria, or the use of probiotics to restore a healthy microbial balance. Unexplained fatigue or brain fog. Unexplained fatigue and brain fog can often be traced back to our gut health, thanks to the intricate communication network known as the gut-brain axis. This bidirectional pathway connects our central nervous system with the enteric nervous system in the gastrointestinal tract, facilitating constant dialogue between the gut and the brain. When our gut microbiota, the trillions of microorganisms residing in our intestines, fall out of balance, it can lead to a state called dysbiosis. This imbalance may result in increased intestinal permeability, often referred to as leaky gut, allowing toxins and inflammatory substances to enter the bloodstream. Once these pro-inflammatory agents reach the brain, they can disrupt normal neural function, manifesting as cognitive impairments like brain fog and persistent fatigue. A systematic review published in the journal 3 Biotech in December 2024 delved into the role of the gut-brain axis in neuroinflammation and cognitive decline. The researchers analyzed various studies and found that gut dysbiosis is linked to increased neuroinflammation, which can impair cognitive functions. While the review did not provide specific percentages, it highlighted the significant impact of gut health on brain function. Moreover, certain gut bacteria are responsible for producing neurotransmitters such as serotonin and dopamine, which are crucial for mood regulation and cognitive processes, An imbalance in these bacteria can lead to altered neurotransmitter levels, potentially resulting in mood disorders and cognitive challenges. In essence, our gut health plays a pivotal role in maintaining our cognitive vitality. An unhappy gut can send distress signals to the brain, leading to symptoms like unexplained fatigue and brain fog. So, next time you're feeling mentally sluggish, it might be worth considering what's going on in your gut. Skin issues like acne, eczema, or rashes. Our skin and gut are more connected than one might think, a relationship often referred to as the gut-skin axis. When our gut is out of balance, a state known as dysbiosis, it can manifest as skin issues like acne, eczema, or rashes. But how does this happen? Let's dive into the science. Our gut is home to trillions of microorganisms, collectively known as the gut microbiota. These tiny tenants play a crucial role in digestion, immune system regulation, and even skin health. When the balance of these microorganisms is disrupted, harmful bacteria can overpopulate, leading to increased intestinal permeability, often dubbed leaky gut. This condition allows toxins and partially digested food particles to enter the bloodstream, triggering systemic inflammation. This inflammation doesn't just stay confined. It can travel to the skin, leading to conditions like acne and eczema. A fascinating study published in the International Journal of Molecular Sciences in February 2024 sheds light on this connection. Researchers from Poland conducted a comprehensive review examining the role of the gut microbiome in common skin diseases. They found that individuals with skin conditions often exhibit gut dysbiosis, suggesting a significant link between gut health and skin manifestations. The study highlighted that modulating the gut microbiota through probiotics could serve as a potential therapeutic strategy for improving skin health. While specific percentages were not detailed in the review, the consistent association between gut dysbiosis and skin conditions underscores the importance of maintaining a balanced gut microbiome. So these were the top 12 strange signs your stomach is crying for help. Now, we want to hear from you. Which of these signs surprise you the most? Do you recognize any of them in yourself or someone you know? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.